Good morning, everyone. Before starting, I will tell a small story. You remember, بحكيها بالعربي لأنه متأثر فيها. صار في انفجار ب4 آب وتدمرت المستشفى عنا مستشفى الروم. وأنا كنت منصاب. وفجأة بيجيني تليفون من الدكتور محمد موسى بيقول لي بيطمن على صحتي، بيقول لي يا عماد كيفك؟ قلت له منيح. قال لي إذا بدك أنت صار عندك محل بمستشفى الزهراء وصار فيك تيجي تفوت مرضاك هونيك. أنا تشكرته كتير لمحمد، قلت له يا محمد بعدني مصاب جديد، بدي شوية وقت أتعافى، بس أنا من وقتها بحس أنه الزهراء المستشفى أنا فيها، مشان هيك جاي بلا كرافات اليوم. كيف بيجي عادة على الشغل يعني. So without transition بعتقد كل الموجودين برجع افسر لك اياها بروفيسور اثناسيوس. اوكي. So we'll begin with this small lecture. يعني هيني على بكره هيك شوي ميزانبوش بقول بالفرنساوي. Erectile dysfunction in young age group. What is the definition of erectile dysfunction? It is the inability to attain and maintain erection for a sufficient satisfactory sexual performance persistent more than 3 months. Attain and maintain, and more than 3 months. So, by definition, it is inability to get and keep erection enough to have a sexual intercourse. Once it was named impotence. What is the meaning of impotence? Impotence in Latin, it is an inability to insert the penis in the vagina. Now we know that erectile dysfunction is much more than this. So we have erectile dysfunction. It is a part of andrology, and andrology is a part of urology. So we are the only specialties that can treat erectile dysfunction. مش مين ما كان في يعالج erectile dysfunction. It may result for reduced interest in sex. The prevalence: 1 over 5 American more than 20 years have erectile dysfunction. Approximately 30 million. And in the young, we have 5% at the 20s, 10% at the 30s, 13% at the 40s. هذه تقريبا approximation to, no, but you have the exact figures. At the 20s we have 8%, 12% at the 30s, 39% at the 40s, 50% الله يسترنا at the 50s, and 60% and more after. So 1 over 4 of our ED patients has less than 40 years. So it is more likely to be difficult to treat if you have an organic erectile dysfunction in a young male. 30% of these guys that have erectile dysfunction and are young are smokers. يعني compared to the whole ED population هذيك 25%. And we have 21% that are using illicit drugs. The anatomy of the penis, you all know that we have 2 corpus cavernosum, 1 corpus spongiosum. The corpus cavernosum are responsible of the erection. The corpus spongiosum also is responsible of the erection, but most of the time it is the passage of the urethra inside. The blood supply, the internal pudendal artery and the internal pudendal vein, pudendal. So we have the 2 corpus cavernosum and we have the urethra. What we have the endothelium, and what happens in the erection? In the erection we have blood, we have relaxation of the muscle surrounding the endothelium, and we have blood getting in the penis, and the blood is we have the tumescence, and rigidity comes when the blood, when the endothelium compresses the veins, and we have what we call the rigidity. And if we have any problem with that, if we don't have any compression of the vein, we have what we call the venous leak, one of the causes. You all know about this, nitroxic oxide, and we have the PDE5. All the medication that we use, and you all know about that, for the treatment of erectile dysfunction are medications that inhibit this enzyme that and will let the equation, the relation, go to the relaxation of the muscles and erection. So it is blood that going into the endothelium, arterial blood, and compression of the venous blood that keep us with erection. So what are the causes in the young? Most of the time, it is psychogenic. If you have to treat a young patient coming for erectile dysfunction, normally you have to talk much with him because most of the time it is psychogenic. And we'll talk about psychogenic and organic erectile dysfunction. We can have drugs also, diabetes, type 1, fibrosis, Peyronie's disease, pain, cycling, hormonal hypogonadism. So we have traditionally to differentiate between organic and psychogenic. And most of the time, we have both of them. Sometimes we become to be organic, and after that, psychogenic, and most of the time, it's a mixed. What is the difference between the two of them? If you look to the age group, when you have an organic, it's more after 50. And the psychogenic ED, it is before 40. So if I'm telling you today, as I'm a presentation, will be more about psychogenic erectile dysfunction. And normally, the category of young people having erectile dysfunction due to organic problem are sometimes difficult to treat. So you all know about this. The onset is gradual with organic, is sudden. The course is constant, variable. And the anxiety and fear, it is the most important thing because actually, the young people are having their education, their sexual education, through videos, through pornos, through things, and they compare themselves to the guy in the video, and they see that they are not performing as well as the guy. نحن بنسميها بلبنان أبو العبد syndrome. I will talk about it next. So if you have a main organic, if you have an organic problem, you have or a vascular problem, a muscle problem, hormonal problem, or neurologic problem. Most of the time, it is a vascular problem. It is a vascular problem because of atherosclerosis, due to diabetes, due to cardiovascular disease, high blood pressure, and for the young people, stress, anxiety, depression, relationship issues, other emotional factors. So we talked about the etiology. We have a vascular problem. It is very important to know what is the structure. We already said that it is blood coming into the corpus cavernosum that make the penis rigid and ready to have sexual intercourse. After the ejaculation, we have what we call the detumescence. Till now, I'm not telling you anything new. What we have, hormonal problem. You can have hormonal problem. Hyperprolactinemia, hypogonadism, diabetes, hyper or hypothyroidism, all of these can cause. And drug-induced, we have many drugs that can cause erectile dysfunction. Some simple drugs like hypertensive, the beta blockers, or antidepressant, antipsychotic, anti-androgen. So we have a list of drugs, and every drug we have when we have a patient coming to us and having erectile dysfunction, we have to know which drug he's taking. So when it is psychogenic, lack of arousability, situational type, yani according to the female. And sometimes with the young male, especially in our countries, in the Arab world, lack of sexual knowledge. تعرفوا مجتمعات محافظة. Poor past sexual experience. Relationship problems. Religious or cultural. Restrictive. Unclear previous sexual abuse إذا كان فيه. And other problems. All of these are in this diagram. What is the most important? It's the performance anxiety. Most of you who consult young people with erectile dysfunction, these patients are talking about the performance anxiety. They fear not to have a good performance. So it is a vicious circle. When we have erectile dysfunction, we have failure, performance anxiety, it's a vicious circle. Every failure is preparing the next failure. So we are going down. Excessive preoccupation with physical disease, unrealistic expectation, all of these are psychological problems. You tell me, do you send this patient to the psychologist or psychiatrist, or you treat him yourself? I think we can do this because with some advice, especially when we see a young patient coming to us with this problem, we have to reassure him and tell him it is not a big problem. We have to do things. And we don't have to have a big knowledge in psychiatry or psychology to treat this kind of patient. In all cases, we do a fasting plasma glucose, and in selected cases, we do, if we suspect any hypothyroidism, hyperprolactinemia, some test. When we do the testosterone, sometimes when you see a patient, he looks like hypogonadal. ما عنده شعر, ما عنده شيء. Sometimes we do the testosterone and we check for hypogonadism. One of the tests, هيك تنتسلى, it is important, what we don't do, is the echo Doppler of the penis. We can do that. And with the echo Doppler, we are seeing here that during the erection, the systolic wave increases and the diastolic decrease. When you have this, it is a normal erection. We can do it without and with erection, and we'll see if you don't have any systolic and the important systolic increase of the wave, it is a vascular arterial problem. If the diastolic doesn't go down, it is a venous problem. And most of the vascular surgeon or our colleagues can measure the resistive index. If it is high, it is important to know that it is good, that it is low, it is not good. How we treat these patients? Like every other patient. أكيد بنحكي أكتر. We talk with the patient, but we have to follow the guidelines. So changing in lifestyle, we have to identify any problem if there is any problem, and we start explaining, understanding, let the patient accept the problem. And most of the time, the first intention treatment is the PDE5 inhibitors. The PDE5 inhibitors that we have in Lebanon, I'm going fast because Dr. Musa told me to do that, is we have 3 PDE5 inhibitors in Lebanon. Outside Lebanon, we have the fourth one. We have sildenafil, the vardenafil, and tadalafil. There are indications for this treatment, and outside Lebanon, we have the avanafil also. Normally, with the young patient, don't hesitate to give him a PDE5 inhibitor because it is a trial. Yani, before then you give him a pill, and he sees that he have a good erection, you tell him with this good erection, you don't have any mechanical problem. So we can start by using it, maybe a small dosage, and after that, we will leave it. We know that we have contraindications for these drugs, and we know that these drugs are not the same for the half-life and for everything. And actually, we know also that different drugs have different side effects according to headaches, flushing, dyspepsia with tadalafil, headache flushing with sildenafil, and everything. The other treatment, we used to have the Vitaros. I don't think it is. I think it is no more available in Lebanon, but we don't have it. We had an experience, not superb. In the United States, they have also the Muse. The injections with the young male, I don't think it is indicated, except for the very rare case of severe erectile dysfunction. So most of the time with the pump also, we don't have any experience. We see it with the books. And the shock waves. What about the shock waves? If you look into the guidelines, there are no clear indication, but they are good for treating I think my personal experience, everyone here can tell me, no, Imad, but you tell the patient it is not in the recommendation. We have not a clear cut about this efficacy, but if you use it, especially for the mild to moderate erectile dysfunction, you can get result. Penile prosthesis, very, very, very rare indication in this class. So before ending, erectile dysfunction does exist with the young male. Most of the time, it is psychogenic. Most of the time, it is due to performance anxiety, because kids here in Lebanon and in the Arab world are asking, يعني كل واحد بخبر التاني أنه بطل بس مش مظبوط. So we have to treat this patient. Start by talking to the kids. Start by talking to the young people. And if you want, I can advise you to give a PDE5 inhibitor. And when they have a good sexual performance, they will thank you. And most of them, they can stop to do it. Thank you very much.